day everyone, I'm Nurse Eldred Mina Pulias. So for today's video, I'm going to performing the segment 1, head, eyes, nose, ear, and the mouth. So first is assemble all the necessary equipment. So in my case, gloves, pen light, and alcohol. So step 2 is to provide privacy for the patient. Next is perform the hand hygiene before wearing the gloves. So after we perform the hand hygiene, we're ready to wear the gloves. So now I'm finished wearing my gloves, so I'm gonna call my patient. Um, Good day, ma'am. What's your name, ma'am?
I'm Jade.
Okay. Ma'am Jade, so for today, I'm gonna assess your head, eyes, ears, and throat. So shall we start? Okay. First is from head. So is it okay, ma'am, to touch your head?
Yes.
Do you feel any pain, ma'am?
No.
So based on the result, the head is normal and the hair of the patient is very smooth to touch and there is no dandruff in his or her hair. I'm gonna touch your face. Is it okay to you?
Yes.
Okay. So based on my description, um the face is normal. Can you please smile, ma'am? Okay. Um as I described to you, your eyebrows is distributed equal and your eyes is normal and your face size is normal. Next, ma'am, is it okay to slowly close your eyes and open your eyes slowly? Um, so the patient has no problem in closing and opening his or her eyes. So next, ma'am, I'm gonna touch your eyes again for the palpating, the lacrimal gland, and nasal lacrimal gland. Is it okay for you, ma'am?
Yes.
Just to come on. So the patient feels no pain as they touch her lacrimal gland and lacrimal gland. In short, everything is normal. So next, ma'am, I'm gonna check your iris, sclera, and cornea, and also the pupil using the pen light. Are you okay with that, ma'am?
Yes.
Okay, ma'am. Okay. As I check your sclera and cornea and the pupil, everything is normal and no swelling and no infection. Everything is normal. Next, ma'am, is it okay to you to cover your eye with your hand?
Yes.
Okay. So I will do like this. So identify this one, ma'am. How many finger?
2.
Okay. This one.
1.
Okay. On the right side. Okay. So how many this one, ma'am?
2.
This one, ma'am.
1.
Okay. So there's no problem with the patient on her eye as I identify my finger with covering his eye with his hand. So, so let's proceed to the Snellen chart. So, this is the Snellen chart, and can you identify every letters? So, what letters is this?
C. F. E. T. O. Z. L. E. E.
So next ma'am is your ear. Is it okay to inspect your ear?
Sure.
And next is I'm going to palpitate your ear. Is it okay to you, ma'am? The cartilage and the mastoid process.
Yes.
Do you feel any pain, ma'am?
No.
So the result is there seems to be no swelling of the cartilage and the mastoid process. Okay, next ma'am is I'm gonna check in your ear using the pen light. Is it okay to you, ma'am?
Sure.
So the patient's ear channel is the same color with the ear, and there is no presence of foreign bodies. There is no cerumen wax, and which is totally normal to the patient. Next, ma'am, is your nose. Is it okay to touch your nose?
Sure.
Okay, so as I touch the patient nose, everything is normal. So next is I'm gonna palpate her nose trail. Is it okay to you, ma'am? Do you feel any pain, ma'am?
No.
So is it okay to you, ma'am, to put your point finger in your nose trail and perform inhale, exhale? Okay, do the same side, ma'am. Do you feel any pain, ma'am?
No.
Okay. So the patient can breathe perfectly normal on her nostril while putting his point of finger. Oh, everything is normal. Next, ma'am, is I'm gonna check in your nose using the pen light. Is it okay, ma'am? No, no, no. Okay. So the patient's nose is pinkish in color, and there's no swelling, no foreign bodies, and no presence of exudates, and everything is normal. So next is proceed to the patient's sinuses, which is the maxillary and the pharyngeal. Is it okay, ma'am, to touch again to your nose? Okay, so
Asan?
do you feel any pain? No.
No.
So next is the physical. Do you feel any pain?
No.
So there are no swelling and no pain for the patient as I touch her sinuses, the maxillary, and the pharyngeal. So now is the mouth. So is it okay to you, ma'am, to smile? Okay. As I describe your mouth and teeth, um, is it normal? Okay. So there are no damages. Is it okay to you, ma'am, to check your teeth first? Okay. So can you open your mouth now? So as I check your teeth, ma'am, there are 32 of teeth, and the color dominant is white. So now, ma'am, I'm gonna check your um, tongue. So can you please take out your tongue? So there seems to be no swelling, no pain, no presence of exudates, and the tongue is in the midline. It is not deviating to left or to the right side. So next is I'm gonna put a little amount of sugar to the patient tongue, and is it okay with you now?
Yes.
So can you take your tongue
Okay,
and
okay.
taste
I'm
the
ready.
sugar?
I'm ready.
Do you feel the sugar amount?
Yes, and it is sweet.
So the patient can taste normal and her sense of taste is normal. She feels the sweetness of the sugar and everything is normal. Can you open your mouth and say tama?
Ah.
So as I check your uvula, ma'am. So the patient uvula is vibrating and moving as she say ah, which is totally normal and it is pinkish color and the tonsils are perfectly normal and there is no also swelling on the uvula or the tonsil. So here are your summarization of findings. So Mom Jade, after assessing your head, eye, ears, nose, and mouth, all findings seems to be normal. No complaints of tenderness and no abnormalities. Overall, Mom Jade, the results are normal. Okay. Thank you, Mom Jade.
You're welcome.
Assessing the patient, so I'm gonna remove my gloves now. Okay. So perform the hand hygiene after removing the gloves. And that's all for the segment 1, head, eyes, nose, ear, and mouth. Once again, I'm Alred Jimena Pondias, your nurse. Thank you for watching and good day.